What if I told you the top reason most men over 60 deal with weak erections isn't low testosterone or even aging? In fact, the real cause might shock you. It could be something as simple as lacking just one vitamin. I'm Dr. Sarah, a men's health expert, and after over 20 years in practice and reviewing hundreds of studies, I've discovered something that could completely change how you approach this deeply personal issue. Subscribe now because this research-backed information often doesn't make it into standard medical advice, and it's something every man deserves to know. In the next few minutes, I'll reveal this overlooked nutrient and explain exactly how it works to restore healthy blood flow, naturally boost nitric oxide, and support the entire system that performance depends on. The science is truly fascinating and could make a real difference in your confidence and vitality. This isn't about risky pills. It's about giving your body the one key nutrient it's been missing to function at its best. Let me share something that completely changed my understanding of this issue. When I first started working with men over 60 who were struggling with performance concerns, I noticed something puzzling. Many of these gentlemen had testosterone levels that were actually within normal ranges. Their doctors were managing their heart health well, their blood pressure medications were working, yet the bedroom struggles continued. That's when I started looking deeper into what I call the silent aging of our vascular system. You see, the real culprit isn't always what we think it is. At 60 and beyond, something happens to the tiny blood vessels throughout our body. They start becoming stiffer, less flexible, and more prone to a kind of internal irritation that most men never hear about. Let me paint you a picture of what's actually happening. Imagine your circulatory system as a well-maintained plumbing network that served you faithfully for decades. The main pipes might still be in good shape. That's why your heart checkups look fine. But the smaller pipes, the ones that feed the most delicate and pressure-sensitive areas, they're starting to develop a problem. There's a molecule in your blood called homocysteine. Now, I don't want to overwhelm you with medical terms, but think of homocysteine as tiny particles of sandpaper circulating through your system. When levels get too high, these particles start roughening up the smooth inner lining of your blood vessels, the very lining that needs to stay pristine for healthy blood flow to occur where you need it most. I want to share Robert's story with you. He's 68, a retired electrician who's been married to his wife Helen for 42 years. Robert came to me already working closely with his cardiologist, who had done an excellent job managing his blood pressure. What Robert wanted was to understand if there were natural approaches he could add to support his overall circulation, particularly for intimate health. Robert's doctor had run comprehensive tests, and something caught my attention. His homocysteine levels were elevated, not dangerously high, but certainly high enough to be affecting the delicate blood vessels throughout his system. I coordinated with his medical team, and together we explored how addressing this underlying vascular irritation might help restore the natural blood flow he was missing. This is where the forgotten vitamin comes in, and I have to admit, even I was skeptical at first. Vitamin B9, also known as folic acid, has been largely overlooked in men's health. Most people think of it as something only pregnant women need, but research from respected medical institutions has revealed something remarkable about this humble nutrient and its role in vascular health. Here's what happens when you ensure adequate B9 levels in your system. Your body uses this vitamin like a skilled craftsman, uses the right tool. It helps convert that rough, sandpaper-like homocysteine into harmless substances that your body can easily process and eliminate. Think of B9 as a protective coating that keeps your vascular pipes smooth and allows blood to flow freely to every area that needs it. The science behind this is truly fascinating. A groundbreaking study published in the World Journal of Men's Health followed men between 40 and 75 who were experiencing performance difficulties. The results were remarkable. Those who received folic acid supplementation showed improvement scores that were over 4 times higher than those who received inactive treatments. But here's what I found most encouraging. Their homocysteine levels dropped by about 20%, showing real improvement in vascular health. What makes this even more compelling is research from The Lancet involving older adults. This large study demonstrated that proper B9 supplementation could reduce homocysteine levels by 25% and improve arterial flexibility by 10%. We're talking about actually slowing down and partially reversing the stiffening that comes with aging. Working with Robert and his cardiologist, we developed a comprehensive approach. We didn't change any of his prescribed medications, we simply added this missing nutritional piece to support his body's natural processes. Within 3 months, Robert noticed something he described as the return of morning confidence. His energy improved, and most importantly to him, he felt like his body was cooperating with him again rather than working against him. But understanding B9 is only part of the story. To really grasp why this works so dramatically, we need to talk about what I call the body's green light system for intimate function. This system depends on a remarkable molecule called nitric oxide. Nitric oxide is essentially your body's signal to dilate blood vessels exactly when and where you need increased blood flow. It's like having a sophisticated traffic control system that can instantly widen the roads when more traffic needs to get through. Without adequate nitric oxide, even if your heart is pumping perfectly and your blood pressure is well managed, you simply won't get the rapid, robust blood flow that intimate performance requires. Here's where B9 becomes absolutely crucial. While it doesn't directly create nitric oxide, it supports the enzyme systems in your body that manufacture this vital molecule naturally and efficiently. It's like providing your body with the raw materials and tools it needs to do what it's designed to do, just more effectively. This is fundamentally different from what happens with prescription medications for performance. Those medications essentially force blood vessel dilation, sometimes regardless of whether your body is naturally ready for it. B9 works with your body's wisdom, supporting the natural signaling system that has served you well for decades, but just needs some nutritional support to function optimally again. Robert shared something profound with me about 6 months into his journey. He said, "Dr. Sarah, what I love most is that I feel like my body is working with me again. It's not that I need to depend on a pill at just the right moment. It's that my natural responses are back. That's the difference between supporting your body's natural processes versus overriding them." Now, I know many of you are wondering about the practical details, and this is absolutely crucial information that deserves careful attention. Before I share specific guidance, I need to emphasize something that I tell every patient. Always consult with your healthcare provider before beginning any supplementation program. This is especially important if you're taking blood pressure medications, blood thinners, or have any chronic health conditions. Your safety must always come first. Based on the clinical research I've reviewed, the dosing that showed benefits for vascular health typically ranges from 800 to 1,200 micrograms daily. However, the exact amount that's right for you needs to be determined by your doctor, who understands your complete health picture and any medications you might be taking. Here's something many people don't realize. B9 works best when it's part of a team. The most effective approach I've seen combines B9 with vitamin B12 and vitamin C. These nutrients support each other's absorption and enhance the overall benefit to your vascular system. Think of them as a skilled construction crew. Each has their own job, but they work better together than anyone could work alone. I also want to address something important that I've learned through years of working with patients. There are actually 2 forms of this nutrient available: folic acid, which is the synthetic form found in most supplements, and folate, which is the natural form found in foods. For most people, either form works well. However, some people have a genetic variation that makes it harder for their bodies to process the synthetic form efficiently. If you've tried folic acid supplements in the past without seeing benefits, you might be someone who would respond better to the natural form, particularly one called methylfolate. This is a more complex topic that definitely warrants discussion with a healthcare provider who can help determine what's best for your individual situation. Beyond B9, research has shown us some fascinating partners in supporting healthy circulation. A study from Israel demonstrated that the polyphenols in pomegranate can enhance antioxidant protection and support blood vessel health. Similarly, research from Saudi Arabia showed that ginger, at appropriate doses, can support healthy blood flow patterns. These aren't magic bullets, but rather pieces of a comprehensive puzzle. When Robert and I worked together, we looked at his entire lifestyle, not just supplementation, but also gentle exercise that he enjoyed, stress management techniques, and nutrition choices that supported his overall vascular health. One of the most encouraging studies I've encountered was published in the American Journal of Clinical Nutrition. It followed men aged 50 to 75 who adopted comprehensive lifestyle changes, a Mediterranean-style diet rich in folate-containing foods, moderate exercise, and stress management. After 1 year, these men showed a 62% improvement in measures of intimate function, along with significant improvements in energy, mood, and cardiovascular markers. What gives me the most hope about this approach is that it addresses the root cause rather than just managing symptoms. We're talking about supporting your body's natural ability to maintain healthy blood flow throughout your entire system. This isn't just about bedroom performance, it's about feeling vital, energetic, and confident in every aspect of your life. I'd love to hear about your experience with natural approaches to circulation support. Have you worked with your doctor to explore nutritional factors that might be affecting your vascular health? Share your thoughts in the comments below. The beautiful thing about this approach is that it respects both your body's natural wisdom and the expertise of your healthcare team. When Robert first came to see me, he was already working with excellent doctors who were managing his heart health expertly. We didn't change that relationship, we enhanced it by adding evidence-based nutritional support that complemented his medical care. What Robert discovered, and what many of the men I work with find, is that when you address the underlying vascular health issues, benefits extend far beyond intimate function. Robert reported better energy throughout the day, improved mental clarity, and what he called feeling like myself again. His wife Helen mentioned that he seemed more confident and engaged in all aspects of their life together. If you're considering this approach, I encourage you to gather this information and bring it to your next medical appointment. Your doctor can help you determine if B9 supplementation makes sense given your individual health picture and current medications. Most healthcare providers appreciate when patients take an active, informed interest in their wellness. One thing I always tell the men I work with is that this isn't about quick fixes or magic solutions. It's about giving your body the nutritional tools it needs to function as it was designed to. The research suggests that most people begin noticing changes within 6 to 12 weeks. Though some feel improvements sooner and others take a bit longer, both timelines are completely normal. The key is consistency and patience. Remember, we're working to reverse years of gradual vascular changes. Just as those changes happened slowly over time, the improvements also develop gradually but steadily. Robert didn't see dramatic changes overnight, but by the 3-month mark, the difference was unmistakable. As you consider this information, what questions would you ask your doctor about adding B9 and its nutritional partners to your health routine? I'd love to hear your thoughts in the comments. Your questions help me understand what information would be most valuable for our community. What I find most rewarding about this work is witnessing the transformation in confidence that comes when men realize they have options. Too many men reach a point where they accept decline as inevitable, not realizing that simple nutritional deficiencies might be major contributing factors to their struggles. Your body has served you faithfully for decades, and with the right support, it can continue to serve you well. The research we've discussed today represents hope, evidence-based, scientifically sound hope that you can influence your own health outcomes through informed choices made in partnership with your healthcare provider. Robert continues his journey today, maintaining both his excellent medical care and the nutritional support we developed together. He recently told me, "I wish I had known about this connection between B vitamins and circulation years ago. I spent too much time thinking my concerns were all in my head or just an inevitable part of aging." The truth is, while aging does bring changes, many of the symptoms we attribute to just getting older may actually be signs of correctable nutritional imbalances. When we address these underlying factors, we often find that our bodies are far more resilient and responsive than we imagined. I want you to remember that taking charge of your health through nutritional awareness doesn't mean abandoning medical care, it means enhancing it. The best outcomes I've seen happen when patients work collaboratively with their healthcare teams, bringing evidence-based information about natural approaches that can complement traditional medical management. Your journey toward better vascular health and renewed confidence can start with a simple conversation with your healthcare provider about the research we've discussed today. Bring the specific studies I've mentioned, ask about having your homocysteine levels checked, and explore whether B9 supplementation might be beneficial for your individual situation. Remember, Every small step you take towards supporting your circulation is an investment in your overall vitality, energy, and quality of life. You deserve to feel strong, confident, and fully alive at every stage of your life. If this evidence-based approach to circulation support resonates with you, I invite you to subscribe to this channel for more research-backed information that honors the partnership between natural wellness approaches and professional medical care. Please share this video with someone who values both scientific evidence and the wisdom of working with qualified healthcare providers. Your health is your most valuable asset, and you have more control over it than you might realize. With the right information, the right professional guidance, and a commitment to consistency,